are dental hygiene students from Coastal Carolina Community College, and we are going to have a presentation for y'all today. My name is Brooke.
My name is Sheena.
My name is Lizette.
And my name is Taylor.
So now that we've introduced ourselves, we're going to go ahead and start with today's presentation. We are going to be teaching you guys how to care for your young children and infants' oral health. So some people may wonder, what is the importance of maintaining healthy baby teeth? There are several reasons why baby teeth are essential for your child's development. The most important thing is that they're placeholders for their future permanent teeth to erupt into. This is important for chewing, speech, their confidence in their smile, and the development of their overall facial structures.
All right, so next we're going to talk about when baby teeth start to erupt. So if you look at this diagram, there are two different colored teeth shown. The white teeth represent the teeth that are erupting into the mouth at that specific month, and then the gray teeth represent the teeth that are already present. So if we take a look at 8 months, that is when the two bottom teeth, the front teeth, will erupt, and then at 10 months, directly above, the two front top teeth will erupt. And then if you take a look at the rest of the diagram, it shows when the rest of the teeth will erupt into the mouth. And by 27 to 29 months, your child will have all of their baby teeth.
Alright, so now we're going to talk about how to brush your infant's gums. So what you're going to want to do is make sure that the infant is comfortable and their head is supported. With clean hands, you're going to wrap a clean and warm cloth around your index finger, and then you're going to dampen the cloth at the tip end with warm water. You're going to wipe the gums gently at least once or twice before and after eating. So now that we know how to take care of our infant's gums, now we're going to talk about how to brush your child's teeth. So what you're going to want to do is, if they're under the age of 3, you're going to want to use a child-sized soft bristle toothbrush 2 times daily. And so you're only going to want to use about a rice size of toothpaste for this child. And then once the child is over the age of 3, you can use a pea-sized amount of toothpaste. You're going to brush all the surfaces of the teeth that are in the mouth, and you're going to make sure to watch them too as well, to be sure that they don't swallow any of the toothpaste and that they spit at the end.
All right, so now we're going to talk about nutrition and feeding. And this is important for your child's teeth because we are trying to prevent tooth decay. So when there is improper bottle or breastfeeding, this can lead to decay after the first teeth start to erupt. So you want to avoid having bottles in bed / breastfeeding before bed. And if you do breastfeed before bed, make sure to rinse your child's mouth out with water before they fall asleep, because we don't want that milk and the sugary substances to sit on your child's teeth for a long period of time overnight. You also do not want to use the bottle as a pacifier for the same reasons, just so they're not sucking on that sugary milk for a long period of time. You also want to avoid at-will access to bottle or sippy cup, and you only want to have a bottle in bed if it contains fluoridated water. Also, do not put sweetened milk, juice, or other sweet liquids in a bottle or sippy cup so your child is not consuming those drinks all throughout the day. And then you want to begin weaning around 6 to 12 months. So you'll want to slowly start to discontinue bottle feeding by age 1, and you're going to switch to a small regular cup instead. And at this age, you can also begin nutritional and fluoride supplementation.
So now we're going to move on and talk about the teething process. When your child starts teething, this can cause your child to experience some irritability, like crying and fussy, increased salivation, so they might be drooling a lot more than they normally do, and they also might experience a low-grade fever. To ease the discomfort, you can give your child a teething ring or massage their gums with like a really cold washcloth. There are several different products out there that you can give your child to help with this. Another thing that you can even do is you can freeze fruit in the freezer and give them the fruit to suck on. Just be aware that there are some products out there that have benzocaine in them, and these products are not recommended for children that are under the age of 2.
Now we're going to discuss non-nutritive sucking, which is a pacifier. Pacifiers are normally used throughout a child's first year of life and continuing on to maybe 3 years old. If a person is breastfeeding, delay the introduction of a pacifier until at least 1 month old. When choosing a pacifier, please choose a solid construction. This means that the ventilating shield should be at least 1/2 inch wider than the baby's mouth. Key things to remember and to avoid is giving an infant a pacifier at night. This causes the teeth and the roof of the mouth to change its appearance. This also will increase the chances of need for braces when the child gets older. Do not clean the pacifier with the patient's or the caregiver's mouth. Use a warm, soapy water to clean the pacifier, and also remember to replace regularly. Scheduling your first dentist visit. Scheduling a dental appointment should be between the first 6 months of a child's tooth eruption. You shouldn't wait until after the age of 1 because we would like the kids to be comfortable with the dentist. Some things that will occur within the first dental visit: examination of the child's head and neck, observation of any plaque, and any discoloration like white spots on the tooth could show significance of decay. Also showing how you to remove the plaque or biofilm, which would be like a small, damp, soft bristle toothbrush to remove the plaque. And also within that appointment, you will use a fluoride varnish application.
And finally, this is our references. If you would like any more additional information or have any further questions, you can take a look at these websites.
Thank you for viewing our presentation. We hope that you were able to take away some good information from this and be able to care for your children's gums and teeth. Also, if you have any other questions, you can give us a call. And then if you're interested in making yourself a dental appointment for a exam, radiographs, and a cleaning, all for only $5, you can give us a call at 910-938-6270. And then we do also see children if they are over the age of 3. So if you do have children that do not currently have a dentist, or do have one but you don't have insurance for your child and would like a more affordable price, you're more than welcome to give us a call to make an appointment for them as well. Thank you.